Good day, ma'am, and to each and everyone. So my name is Eliza Cristoco Ferreras from BSN1A of Iloilo Doctors College. And for today, I'm going to perform a demonstration about cleansing bed bath. So what do we mean by cleansing bed bath? So this is where we bath our patient while they are on bed. So the general objectives for this is to stimulate the circulation in order to increase the functioning of the skin, promote muscular relaxation, to relieve muscular fatigue, to clean skin and refresh the patient, and also to observe unusual signs and symptoms. Okay, so the first thing that we're going to do is to assemble all the equipments at the bedside. So I have here prepared all the equipment at the bedside.
So in here, we will be needing 2 wash basins, a pitcher with warm water, bedpan, comb, hygienic products such as skin lotion, and deodorant or powder. We have our soap, disposable gloves, 2 washcloths, bath blanket, and 2 bath towels. We are going to prepare the table with table protector, clean gown, and laundry bag.
The first thing that we're going to do is to identify our patient. So this is to ensure that we have the right patient in front of us. Hi there, good day. How are you doing, ma'am?
I'm good.
Okay, that's good. So let me take a look at here your ID badge. Can you please state your name as well as your date of birth, please?
Edward Funda, November 6, 1971.
Okay, that's great. So by the way, ma'am, my name is Eliza Cristoco Ferreras and I am your student nurse for today. So what I'm going to do here is to do a cleansing bed bath. So why do we have to do this? So this is to help you stimulate the circulation, to promote a muscular relaxation, to clean your skin as well as to refresh your body. So is it okay with you, ma'am?
Yes, ma'am.
Okay. So the next thing that we're going to do is to assess the client's preferences for bathing practices, frequency of bathing, preferred time and day, and type of hygienic products used. Okay, ma'am, so I'm going to ask you a few questions, okay?
Yes, ma'am.
Alright, so may I ask you, what in terms of your hygiene products, what are you using? Are you using deodorant or powder?
Deodorant.
Okay, so how about in terms of soap? Do you have any allergies with soap?
No.
Okay, so thank you for that. So the next thing that we're going to do is to consider client's condition and review order of precaution concerning client's movement on positioning. So I'm going to take a look at my client's record. By reviewing records, it prevents accidental injury to patient during bathing activity. Alright. So after that, we are going to adjust the room temperature and ventilation. And if there is any curtains or doors within the area, we need to close them in order for us to provide privacy to our patient. So the next thing that we're going to do is to do hand washing and don our gloves.
Washing hands reduces transmission of microorganisms. After we wash and glove our hand, we are going to offer the client a bedpan or urinal and also provide a towel and washcloth for client, so that client will feel more comfortable after voiding and it prevents interruption of bath.
Just tell me, ma'am, if you're done. So are you done, ma'am? We are going to dispose this and leave the bedpan.
Then we are going to dispose the used washcloth and dispose also our gloves. We are going to perform again hand washing and don our gloves. If applied to hospital bed, pull side rails up. The purpose in raising the side rails maintains safety as you leave the bedside. Fill wash basin 2/3 full with water 43 to 46 Celsius or 110 to 115 Fahrenheit. Then dip client's finger in water to test temperature tolerance. Warm water promotes and prevents chilling. Testing temperature prevents accidental burning of client's skin.
So ma'am, I'm going to ask you to put your hands here and tell me if the water is Tolerable. Is it okay?
Okay, ma'am.
Thank you. Right, so Ma'am Pam, I'm going to guide you to move closer to me, okay?
This facilitates access without undue reaching and straining.
So Ma'am Pam, I'm going to ask you if is it okay that I'm going to remove your pillow, or I will just leave it there for you to provide comfort.
Just leave the bed pillow, ma'am.
Okay, so I will take note of that. So it is important for us to respect our patient's preference in order for her to have a comfortable while we are going to take her a bath.
Then we are going to place bath towel under client's head. Placement of towels prevents soiling of bed linen. And we are going to grab our bath blanket and place it over the top sheet. Next is we're going to loosen top sheet covers at foot of bed. Fold and remove top sheet from other blanket. If possible, have client hold bath blanket while you withdraw the sheet. Removal of top linens prevents them from becoming soiled or moist during bath. Blanket provides warmth and privacy. If top sheet is to be reused, fold it and place in the back of the chair. If not, dispose in laundry bag. Don't allow linen to come in contact with your uniform. Assuming that our patient has intravenous tube or the affected area here, we are going to remove the client's gown from the arm without IV tube first. And in removing client's gown, we are going to provide privacy. If the extremity of our patient is injured or has reduced mobility, removal starts from an affected side. By doing this procedure, it provides full exposure of body parts during bathing. Addressing an affected side first allow easier manipulation of gown over body part with reduced range of motion.
And then we're going to place the towel on our patient's chest under her chin.
This prevents the soiling of bath blanket. So we will be needing a washcloth, and we are going to immerse it in water and wring thoroughly. Fold washcloth around fingers of your hand to mite. Wash the client's eye with plain warm water. In cleaning the eyes, we are going to move mite from inner to outer canthus. Bathing eye from inner to outer canthus prevents secretion from entering nasolacrimal duct, and pressure can cause internal injury. Use different section of mite for each eye. The use of this method can reduce infection transmission. Remember, we don't apply soap because it can irritate the eyes of our patient. And then we are going to dry the eyes of our patient with the use of bath towel in a tapping motion. Ask the patient about preference for using soap on face.
Do you prefer to use a soap?
Yes, ma'am.
Soap tends to dry face more quickly because it is exposed to air more than any other body parts. Wash and rinse the forehead, followed by cheeks, nose, neck, and ears in S stroke. And then we are going to dry while using our bath towel.
After this, we're going to place the towel on the left side.
Remove bath blanket over client's arm that is farthest from you. Place bath towel lengthwise underarm. Bathing far side first prevents reaching over clean area. If we are performing using the hospital bed, we are going to lower side rails if moved to opposite side. Bath arm with soap and water using long, firm strokes from distal to proximal, or what we call finger to axilla. Raise and support arm above if possible while thoroughly washing axilla. Soap lowers surface tension and facilitates removal debris and bacteria when friction is applied during washing. Long firm strokes stimulate circulation, and movement of arm exposes axilla and exercise joint normal range of motion distal to proximal to increase venous return to the heart. After we wash, we're going to rinse and dry arm and axilla thoroughly, and we can apply deodorant or talcum powder according to the client's preference.
We're going to apply deodorant.
Remember that excess moisture causes skin maceration and softening. And in our case, and according to the client's preference, we are going to use deodorant because deodorant controls body odor. And then we are going to fold bath towel in half and lay it on a bed beside client. Place basin on towel. Immerse client's hand in water. Option: allow hand to soak for 3 to 5 minutes before washing hand and fingernails. And then remove basin and dry hand well. Soaking or washing fingernails soften cuticles and calluses of hands and looses debris beneath nails. Soaking also enhances feeling of cleanliness, and thorough drying removes moisture from between fingers. Next is we're going to do the same process on the arm that is nearer to our area. Then we are going to check temperature of bath water, and we are going to change it if necessary. Use of warm water maintains client's comfort. And we are done changing our water. Then we are going to cover the client's chest with bath towel and fold blanket down to umbilicus. It prevents unnecessary exposure of body parts. Next is we are going to lift edge of towel away from the chest of our patient, and with mitted hand, we are going to bath the chest using long firm stroke. And then keep chest covered between wash and rinse periods. Then dry well. This procedure maintains warmth and privacy to our patient. We need to take special care to wash skin folds under female client's breast, lifting breast if necessary. Secretions and dirt collect easily in areas of tight skin folds. After we wash the chest of our patient, of course, we are going to rinse it and dry well with a bath towel. Place bath towel lengthwise over chest and abdomen. Then fold blanket down to just above pubic region. Through this, it can prevent chilling and exposure of body parts of our patient. With one hand, lift bath towel. With mitted hand, bath abdomen, giving special attention to umbilicus and abdominal folds. Stroke from side to side. Keep abdomen covered between washing and rinsing. Then, dry well. We need to take note that moisture and sediments that collect in skin folds predispose client to skin maceration and irritation. After we wash and rinse the area of chest and abdomen, we are going to dry it using the bath towel. Next is we're going to cover chest and abdomen with top bath blanket. This prevents unnecessary exposure. Next is we're going to clean the legs of our patient. So we are going to expose first the far leg by folding blanket over toward midline. And be sure perineum is draped. Then we are going to assist the patient to bend the knee by positioning our arm under their leg. While grasping client heel, elevate leg from mattress slightly. And put the bath towel at the side in lengthwise position under leg. This prevents soiling of bed, support of joint and extremity during lifting, prevents strain on musculoskeletal structures. We are going to ask our patient to hold still and place bath basin on towel on bed and secure its position next to foot to be washed. Unless contraindicated, use long, firm stroke in washing ankle to knee and knee to thigh. And dry well. By doing this promotes venous return. Long, firm stroke should not be used for client with blood clots, so we should remember that. With one hand supporting lower leg, raise it and slide basin under lifted foot. Immerse one foot at a time. Make sure foot is firmly placed on bottom basin. Soap foot, making sure to clean between toes. Rinse and dry well. Take note that secretions and moisture may be present between toes. After we bath the foot, leg, and thigh of our patient on the farther side, we are going to do the same thing with the leg, foot, and thigh that is nearer to us.
Since that we use it on the foot of our patient, we are going to replace it with a clean water.
After that, we are going to cover the patient with bath blanket. And if we are using hospital bed, we are going to raise side rail for client safety. After using this on our patient's foot, we are going then to dispose the water and change the bath water. We need to bear in mind that drop in water temperature during bathing can cause chilling. So clean water reduces transmission of microorganisms. If we are using hospital bed, we are going to lower side rail, assist client in prone or side-lying position, and place towel lengthwise along client side. We are going to expose the back and buttocks for bathing. We need to slide bath blanket over shoulders and thighs. Maintain warmth and unnecessary exposure. Wash, rinse, and dry the back of our patient from neck to buttocks using long firm strokes. And pay special attention to folds of buttocks and anus. And that is because skin folds near buttocks and anus may contain fecal secretions that harbor microorganisms. After we clean and rinse the buttocks and back of our patient, we are going to dispose the washcloth and exchange it into new one and then dry the back of our patient. Changing of bath water and washcloth prevents transfer of microorganism from anal area to genitalia. After that, we are going to assist client in side-lying or supine position, cover sheet and upper extremities with towel, and lower extremities with bath blanket. Expose only genitalia, then wash, rinse, and dry perineum. Give special attention to skin folds. If client is able to do perineal care, leave washcloth, basin, and soap within easy reach and leave area. But this time, we will be using a different washcloth. So since that my patient can able to do perineal care, so I'm going to assist her by giving her a washcloth, and then I'm going to give her a privacy. It maintains the patient's privacy, so patients capable of performing partial bath usually prefer to wash their own genitalia. Remember that skin folds are site for accumulation of secretions and moisture. We are going to do the same thing as I'm assisting my patient to rinse her genitalia. And then we are going to dispose the used washcloth. And then we are going to remove the bath towel. And then we are going to pull the bath blanket towards the chest of our patient. We are going to help our patient to comb their hair, and this is to maintain their body image. After this, we are going to dispose gloves in receptacle. This is to prevent transmission of microorganisms.
Ma'am, do you want to apply lotion in your skin?
Then we are going to apply additional body lotion or oil as desired. Start with the hands of our patient. Then we are going to apply the lotion from the thigh up to the foot. So the lotion helps to retain moisture. And according to my patient's preference, she wants to apply lotion to her back. And as I apply the lotion, I also gave her a back rub or back massage. Then we are going to assist the patient to put on a clean gown. If one extremity is injured or immobilized, always dress affected side first. Dressing affected side first allows easier manipulations of gown over body part with reduced range of motion. After that, we are going to straighten patient's bed. This provides a clean environment for our patient.
That's all. Thank you.